Hello, I'm Monica Hendrickson, the Public Health Administrator for Peoria County Health Department, and welcome to our weekly Facebook update. For Thursday, October 15th, the to-date count for the Tri-County of Peoria, Tazewell, and Woodford sits at 6,882 cases. That includes 4,076 for Peoria County, 2,260 for Tazewell County, and 546 for Woodford County. There's a significant increase in the number of cases reported for Woodford County, and that's due largely to a delay in lab reporting. Overall, in the past week, we've seen 592 new cases in the Tri-County, and that's up close to 200 more from the previous week, where we saw only 405 new cases that week. Overall, this week saw 284 new cases for Peoria, 241 for Tazewell, and 67 for Woodford County. We're sad to report today 2 additional deaths in Woodford County. One is a female in her 90s at Heritage Health in El Paso, and the other is a female in her 60s with comorbidities not associated with a long-term care facility. That brings the to-date totals for the Tri-County to 107 new cases. That's 13 more than the previous week. The 7-day average for the Tri-County rose from 58 new cases to 85 new cases, with Peoria County seeing specifically an increase from 29 to 41. Again, this growth in number of cases is something that we all need to monitor and continue to do those safe practices. While the majority of our cases are recovered, 85%, we still have 12.4% that are at home and isolating, and just under 1% and hospitalized. Regarding our hospital data, which includes OSF St. Francis Medical Center, UniPoint Health Peoria, which is Proctor Methodist, and Pekin, we have a total of 24 individuals in the ICU. That includes 4 under investigation and 20 that are confirmed, as well as 45 individuals in non-ICU beds. 24 is actually the highest number of ICU beds in use since we began reporting this data since April 1st. Our ICU 7-day average sits at 21, and our non-ICU beds at 39. This increase is something, again, that we want to continue to monitor as we get into colder weather, where we see a couple of things. One, some of the things that we were able to do over the summer, such as socially distance, be outside, becomes difficult as the seasons change. So while we gather inside, we need to be much more vigilant about social distancing and wearing masks. Likewise, we're also running to a season where people are going to have other viruses that come through, specifically influenza. And so again, as we talk about that limited resource we have, which is our healthcare capacity, we want to make sure that we all have the ability to utilize it when we need it. So again, doing those mitigation factors as well as getting your flu vaccine is going to be imperative this year. Another thing to note is that today the Illinois Department of Public Health is going to be reporting both molecular and antigen testing as part of our statewide testing in our region. Now, so far, antigen testing has accounted for less than 1% of all of our testing, but with more and more antigen testing coming out, especially the Buy Next Now, we see one that is, more accurate and more readily available. And so with that, Illinois Department of Public Health will now be reporting both the molecular and the antigen testings as of today. What do we expect to see? Would you expect to see an increase in the number of positive tests? Likewise, we should also see an increase in positivity. We're going to monitor this because we want to make sure that with both the number of increased tests and positivity, that we are capturing and getting ahead of this virus. And again, that means not only practicing the mitigation, but if you get a call and it may be a 312 area code and it's listed as COVID contact, please answer that. That is our state's contact tracing phone number. Once you pick up, it'll be routed to your local health department. Likewise, if you missed a call and call back, they will either route you to your local health department or ask for your zip code to get you to the right location. Either way, you need to answer that phone. That's our first step in getting that key information to get ahead of this virus. And that information is important because when we're able to do that, we're able to contact individuals and get them to quarantine and isolate appropriately. And that is why yesterday you did see the Peoria County Health Department issue a health advisory. Our health advisory was for those visitors attending services at Cedar Hills Baptist Church in Dunlap on Sunday, October 4th, that may have been exposed to COVID-19. We're asking individuals to continue to monitor their health for COVID-19 symptoms for 14 days and seek treatment and testing if needed. We would like to update that based on additional information. The notice now extends to the unlicensed daycare, preschool, and aftercare programs that are affiliated with the Cedar Hills Baptist Church in Dunlap. Children attending those programs on the day of 10/4, as well as since then, need to quarantine for 14 days. Parents and caregivers of children attending those daycare programs may need to choose alternative child care through one of the many licensed programs that DCFS offers. Again, if you have any questions about this, all of this information is available on our website, www.pcchd.org. And again, as we continue to move through this not only colder season, but into the holiday season, IDPH released additional guidance about the holiday season. Now, let's make one thing very clear. No one's asking you to cancel or forego your holidays. We do want people to gather. We want to have you feel fellowship and be with loved ones. But the key is to do it safely. Again, social distancing, wearing face coverings, and if you are sick, staying home and isolating away from others and getting tested, and then still staying in isolation until your test results come back. Again, we want everyone to stay healthy and safe. Thank you, and then we'll talk next week.